my name is Tram Nguyen. I am a class of 2021 Pharmacist Candidate, and today I'll be talking about Metformin, which is the only drug in the biguanide class used for diabetic patients. So the first thing I'll be going over is the patient consultation. So Metformin is used to lower blood sugar in diabetic patients. It's recommended to take it with food to decrease the upset stomach or diarrhea, and make sure you take it at the same time every day. For the extended release formulations, do not chew or crush the medication, and some common side effects of metformin includes diarrhea, GI upset, nausea, vomiting, and headache. And metformin does cause vitamin B12 deficiency in some patients, so it's recommended to take precaution and start taking multivitamins or vitamin B12 vitamins to help supplement this deficiency. So why metformin? So metformin is used in most diabetic patients because it's affordable and covered by most insurance plans. It has minimal side effects in most patients and very effectively decreases the A1C by 1 to 2%. It also has benefits for weight loss and as well as cardioprotective, and it has rare or no hypoglycemia and favorable lipid effects. So as for the indications, metformin is FDA approved as the first line for type 2 diabetes. It can decrease the A1C by 1 to 2%. And some off-label uses of metformin includes polycystic ovarian syndrome, antipsychotic-induced weight gain, gestational diabetes, and prevention of type 2 diabetes. And metformin comes in tablet, suspension, and solution in the immediate release and extended release formulations in the strengths of 500, 750, 850, and 1000 milligram. It's also available in combination with other anti-diabetic drugs. As for the dosing, for type 2 diabetes, at the initial start of metformin, of the immediate release formulation, 500 milligram twice a day or 850 milligram once a day with meals, and the dose is increased to the maximum tolerable dose by increments of 500 every week or 850 milligram every 2 weeks, and the maximum of 2,550 milligram per day. In doses greater than 2,000 milligram per day, it's probably better tolerated if given in 3 divided doses instead of 2. So consider the patient's renal function before starting metformin. So at initiation, if the patient's eGFR is less than 45, it is not recommended to start metformin. But if it's less than 30, it's contraindicated to start metformin. And after metformin initiation, if the eGFR falls below 30, then the therapy needs to be discontinued. But if it falls below 45, it's necessary to assess if the benefits of therapy outweighs the risks. And if the decision of continuing therapy is warranted, then the dose needs to be decreased by 50%. So for the mechanism of action of metformin, metformin works to decrease the liver glucose production, decreasing intestinal absorption of glucose, and improving insulin sensitivity by increasing peripheral glucose uptake and utilization by the liver, skeletal muscle, and adipose tissue. So some common side effects of metformin includes diarrhea, nausea, vomiting, flatulence, appetite suppression, headache, loss of strength and energy, dyspepsia, and metallic taste. And as I mentioned earlier, vitamin B12 deficiency, hemolytic anemia, and a black box warning that metformin carries is lactic acidosis, which resulted in death, hypothermia, hypotension, and resistant bradyarrhythmias. Metformin is pregnancy category B, and unlike some of the other drug classes for diabetes, metformin does not cause hypoglycemia and does not cause weight gain. It's actually beneficial for weight loss. Some warnings and precautions of metformin, as I mentioned earlier, lactic acidosis. Some risk factors for lactic acidosis include renal impairment, age of 65 or older, hypoxic states such as acute congestive heart failure, excessive alcohol intake, and hepatic impairment. So if metformin associated lactic acidosis is suspected, immediately discontinue metformin and provide supportive measures in a hospital setting, as well as prompt hemodialysis is recommended. In heart failure patients, metformin may be used in patients with stable heart failure, but avoid use in unstable heart failure or during exacerbations. And as for vitamin B12 deficiency, make sure you monitor the serum vitamin B12 levels in patients taking metformin, especially those with peripheral neuropathy or anemia. And the last precautionary warning that I have for metformin is iodine contrast imaging procedures. So in patients with eGFR between 30 to 60, or history of liver disease, alcoholism, or heart failure, or those who will be getting intra-arterial iodinated contrast, it's recommended to discontinue metformin at the time of or before the procedure and reassess the eGFR 48 hours after the procedure. So some monitoring parameters for metformin. So for efficacy, monitor the blood glucose, the A1C every 3 months if the goals are unmet, or at least twice a year, so every 6 months if it's well controlled. As for safety, monitor the renal function, so eGFR at least annually, and the serum vitamin B12 concentration every 2 to 3 years, and hematologic tests such as hemoglobin, hematocrit, RBCs at baseline, and then annually. And that is all for my presentation. Thank you.